Hey guys, this is Dr. Ken here with Purpose Physical Therapy. If you're a pickleball player, this video is for you. There are prerequisites that, from a mobility standpoint, in our hips and our back that we must have in order to effectively play a sport like pickleball and to help prevent injury. And that's the hip hinge. The hip hinge test is gonna expose the movement and whether we're able to what we call disassociate our lumbar or low back movement to our hip movement. It's also gonna let us know how stiff or how lax or how flexible our hamstrings are. So for the hip hinge test, you're gonna wanna grab a PVC pipe or a broomstick, and you're gonna set up as such where it's gonna be behind your back, maintaining 3 points of contact between the stick and your body. So that's the back of your head, the middle of your back, and then your sacrum or buttock area. Your feet are gonna be shoulder width apart, a soft bend in the knee, and then from here, you're gonna hinge forward as far as you can without losing any of the points of contact in the stick. Now, if you're hinging forward and you start to lose any point of contact, most commonly the bottom as such, then we're gonna test to see, is it the hamstring tightness that's affecting that movement, or is it just a control issue? Let's check to see if our hamstrings are actually tight and short. The way to do that is to lay on your back. You can hold on to the stick, and you're gonna do both sides. But what you wanna do is kind of have this stick down towards the end in the middle of the thigh, and you're gonna kind of press the stick down into the floor, and at the same time you're gonna raise the one leg, keeping the other one still, as far up as you can. And the goal is to be able to get that heel past the stick without the knee bending. All right, so if you did the hip hinge test and you failed it, whether it's because of your hamstring tightness or you can't seem to get the movement right, I want you to let us know which one it is, how you failed it. Reply directly to this email that we sent to you, and then stay tuned for the next email, and we'll send you some videos on ways that you can effectively improve it.